Hi, everybody. Welcome to today's webinar. It's titled Motivational Interviewing, the Key to Effective Conversations About Change. I'm Mark Graben. I'm the host and moderator for today's session. I'm a senior advisor for KaiNexus. If you're not familiar with KaiNexus and our company and our software, I encourage you to check us out at KaiNexus.com. We're really pleased to be joined today by our presenter. She's Paola Torres. She's a senior performance improvement manager at Health First. All right, so again, our presenter today is Paola Torres. She is a Lean Six Sigma Master Black Belt and continuous improvement professional with 17 years of experience in healthcare. She's currently senior performance improvement manager at Health First in New York City. And prior to joining Health First, she was the director of supply chain transformation and integration at NYU Langone Health. That's where Paola and I first crossed paths some years ago. And, as a Lean Six Sigma practitioner and coach, Paola has led over 40 cross-functional Kaizen or rapid improvement events, integrating change management concepts and adult learning theory into applied process improvement science. She is a native of Colombia. She received her BS in microbiology and an Masters of Public, MPA, Masters of Public Administration.
Public Administration, Healthcare Policy and Management from NYU. Thank you, Mark.
So thank you for finishing the introduction. And with that, Paola, I will give the stage to you. Thank you for presenting today.
Well, thank you so much for having me here. I think this is a great opportunity to learn about motivational interviewing. So thanks for everybody for attending the session. I just want to start with a quick overview of our learning objectives. At the end of the session, my expectation is that you become familiar with the practice and the spirit of motivational interviewing. I also expect that you're going to be able to identify your customers' readiness for change based on some key communication indicators that I'm going to describe during the session. And finally, I'm hoping that you will learn some communication techniques that you might be able to apply in your work environment to help your customers resolve the ambivalence to change that we all feel. So before we move forward, these are my learning objectives, but I want to learn a little more about you. So let's take a moment and think about the following. What motivated you to attend this webinar? So please type in the chat right now. What do you want to get out of this webinar? What motivated you to attend the session? So I'm really curious. Maybe you want to gain more support from your leadership. You have a change initiative that you want to implement and you want to gain more buy-in, or maybe you're simply curious about the topic. So I love to learn a little more about your own objectives. I see knowledge. I see better communication, practical examples, change team members. So those are all fantastic answers. Thank you. So if there's anything that I'm not able to cover or that is not clear during the session, I just want to make sure that it's clear that I'm available. And if you want to reach out, please feel free to reach out. I want this to be something that provides value to you. In my own words, motivational interviewing is a targeted communication style or a deliberate attempt that we make to influence somebody's readiness to change based on the conversations or through the conversations that we have with our customers. The idea is that we want the customers to develop or to identify and develop intrinsic motivation. We want them to find their own reasons and to identify their own, how their own values aligned with a particular change initiative so that they develop and they support that initiative based on their intrinsic motivation. And that's something that only the customer knows. We can't really do that for them. And that is definitely the key to effective change management. That intrinsic motivation is really the key to leading change effectively in an enterprise. So I think motivational interviewing has gained significant momentum in in recent years. And I can say that my hypothesis is that there is a need now, and especially in the US, we went through a transition in the industry from a traditional fee-for-service payment system, a payment system that rewards volume, to a payment system that now rewards healthcare outcomes. So really, we need to do more than just provide medicine or treatment to our patients, right? We need to enable them, and we need to help them develop healthy behaviors. And to do this, we need to kind of change how we practice medicine in a certain way. And motivational interviewing, it's an evidence-based, proven framework used in therapy, using behavioral therapy that enables behavioral change. It's proven to be very effective. Psychologists have identified that it's a methodology that is tremendously effective to help people embrace new behaviors. And I think that's also why motivational interviewing, it's now being embraced by care managers, by nurse practitioners, by other clinical care providers that also need to help patients and help the members, perhaps, of a health plan develop new behaviors, healthy behaviors that support the healthcare outcomes that are typically the metric that providers are normally measured on. And I've also noticed that the process improvement field has identified the need to integrate the change management principles, including motivational interviewing in our practice. So there's an excerpt from the Institute for Healthcare Improvement that describes motivational interviewing as a key piece of managing the implementation of the outcomes of a Kaizen or a process improvement initiative. Oftentimes we hear consultants complain about the fact that it didn't sustain. And perhaps the answer to that is the fact that the team members really never develop intrinsic motivation or really embraced the changes that came out of the Kaizen or came out of the initiative to the fullest. So I think those two data points are not a coincidence. And I hope that you guys find this topic exciting. There's definitely momentum. So I'm going to cover these three topics. I'm going to start with a little bit about behavioral change, so set the tone and really kind of connect that to motivational interviewing. And then I'll talk about motivational interviewing in detail, and then we'll do the application piece. So here is the stages of change. This is the theory that Dr. Prochanska and Di Clementi described in the 1970s. And the idea is that we used to think about change as almost that something that happens or takes place overnight, almost like you turn on a switch and all of a sudden you just quit smoking. But in reality, change is a process, and we need to go through all these phases in order to really get to the action stage, in order to really develop at the end a new habit. And oftentimes what happens is that there is a misalignment between what we want our customers to do, right? And where they are in the change process. So our expectation is action when they're behind in the change process, when they're not even close to the preparation of action stage. So since we need to go through all these 4 stages, we need to go from pre-contemplation to contemplation to preparation and action. If we start prescribing or telling people what to do, assuming that they're in the action phase, our expectations are not in alignment with what the person is actually ready to do. An example from the clinical setting is a patient goes to see a primary care provider. The provider prescribes cholesterol medicine and also behavioral change. So also a healthy diet and exercise. The patient might say, I love red meat. Everyone in my family eats red meat. We all live until 90, and I don't think this is something that I need to do now. So they're in pre-contemplation, not even aware that their diet has an impact in their overall health. So this also happens in an enterprise, right? We sometimes have conversations with managers, and they might say, I created this standard operating procedure, and my staff is not implementing anything. And I always find it really interesting because, so you created the SOP, or the standard operating procedure, because you probably went through a change process on your own, right? You identified that there was an issue, there was a need to have standard work. Then you created the SOP, and you went through all this, pre-contemplation, right? Now aware of the issue, now I take action. But your staff has not gone through the same process. So they're behind. Some of them are going to be in pre-contemplation. Some of them might be in contemplation. So the expectation that they would embrace that, it's really not feasible. So that to me is like one of the most one of the biggest aha moments that I have had as I started learning about behavioral change and specifically motivational interviewing. So the idea is that we want to use motivational interviewing in those early stages, right? In the pre-contemplation and contemplation, so that when we get to the action, to the preparation and action phase, our customers are aligned with what we want them to do. So that's essential. This is like if you turn on the electronic health record tomorrow, and I'm sure you're going to have a lot of people are going to not be happy about it, right? So you have to give them time to go through that process. Change is a process. The other two concepts that are important and are connected to motivational interviewing are the concept of the writing reflex and the concept of ambivalence to change. If we go back to the previous slide, we have the pre-contemplation when we're not aware of the change, to contemplation where we're now aware, but at the same time, we're not ready to take action. And the concept of ambivalence to change is that as we think about embracing a new habit or developing a new habit, we experience these yes and no kind of voices or feelings in our head, right? Reasons to support the change. In motivational interviewing, that's called change talk. And then reasons to not do it, sustain talk. So it's like you have the two voices in your head. Yes, I want to do this. No, I don't want to do it. That is that ambivalence to change. And then I'm going to illustrate the concept of the writing reflex with an example. Since the pandemic started, I have been wanting to wake up at 7 a.m. in the morning and go for a run, because I read that exercising in the morning is really good for you. So I want to build that new habit. I tend to exercise in the afternoon, and it interrupts my sleep schedule sometimes. And I haven't been able to do it. And I was having a conversation with a friend, and I was sharing this with her. Like, I really want to exercise in the morning, but I fail and I'm not being able to do it. And then she said to me, well, it's simple. Like, one thing that you can do is set up an alarm, and at 7:30 that says run, and then that's your reminder. If you wake up at 6 a.m., then at 7, you know that you need to be exercising, you need to go for a run. And as she was, telling me what to do with good intentions, I just started feeling, not very comfortable with the conversation. And I just started thinking about it. I was like, do I really need to exercise in the morning? So she basically activated that other voice in my head of, no, I don't need to do these. And this is foundational to motivational interviewing, is that when we tell people what to do, that writing reflex that we all have, and especially when you're a consultant or when you're a counselor, when you are a clinical practitioner, sometimes hinders that change process. Because instead of like helping people express that change talk, which is what is really going to help them move to the action phase, we help them express the other side of the coin, the sustain talk. So the goal here is that we want people to express change talk, because people tend to implement or do what they hear themselves say. So that's the piece. We want them to hear them say what we want them to do, but we don't want to be telling them to do it. So that's I think to me that was also really interesting. So that's the idea. We want to help our customers resolve their ambivalence. We want to use motivational interviewing to do that. And if we think about the life cycle of a project, the end result is always going to be action, right? We want people to document perhaps something in an EMR system in a different way. We want them to implement a new nomenclature. So we want to ensure that we resolve that ambivalence, that our customers resolve that ambivalence during all the interactions of a particular project or an initiative, so that when we go to the action phase, they're ready and we can have success. And so here I do want to pause maybe if there's any questions. I see the chat going. Mark, I don't know, I have not had time to look at it. If there's anything that people, questions that they might have, I think I could address them also quickly.
Well, there have been a lot of comments about why people are attending today. There aren't any questions that come in so far.
All right, so then that's good, thank you.
Okay.
So now let's take a moment and think about this. What did you discuss during the last meeting that you had with your customers or with a client? And also, let's think about this. Had you changed or would that meeting had been completely different if this was a customer or a client that was told to work with you versus a customer or a client that openly reach out to you, that really identified you as the person that he wanted to work with? So maybe just take a second and type in the chat first. What did you discuss during your last meeting with a customer or client? So I'm curious to kind of learn a little more about that. And then I don't see it. So I think, and then maybe just let me know if anything changed, right? If you would change your approach, if you your customer or your client was told to work with you instead of like openly reaching out to you. So let's see, what do we see? Progress on projects. We encountered a second version regularly, forensic programs, so some topics. Sales. And so what about the second question? I'm curious. So maybe you can say yes or no. Do you think there's any difference between an interaction with that particular customer when you compare a customer that is openly or that reach out to you because they wanted to work with you versus a customer that was told to engage with you? So do you see a difference, yes or no? I'm just curious about what everybody has to say about that. Absolutely. Okay. Yeah. I think that's really important. And that's sometimes a piece that it's not always clear to us, right? If there was intrinsic motivation to begin with, and here is where MI is also very helpful, because it's going to provide a roadmap to really help the people that are in that pre-contemplation stage. Anybody who is told to do something, to work with you, this is really going to provide a framework for you to gain their support, or gain their buy-in, and create good engagement, because they're not even engaged. Most of the change management theories start with the engagement phase. So I think that's super essential here. So I don't want to oversimplify complexity, and as we take a deeper dive into the motivational interviewing concept, I want to make sure that I highlight that even though we're just going to discuss here the MI process and then some of the interviewing skills, the open-ended questions, affirmations, summaries, reflections, there are other elements that are relevant to the MI framework. And I think to really do it well, it's also a cohesive framework. We can't just take just one piece and assume that it's going to work. So the interviewing skills work, but the principles and the attitudes or the spirit of motivational interviewing is essential. So it's really about collaboration, acceptance, partnership, empathy, right? So if we think about asking open-ended questions, if we don't do it with that empathetic spirit, with really wanting to learn more, and if it doesn't come from a place of acceptance and empathy, I don't think it will lead the same results. So I think that's really important, because sometimes we take one piece and we think that it might work, like might be able to just apply it, but in reality, it's a cohesive framework. So this is the MI process. And basically, here are the 4 stages that you go through as you have an interaction with a customer or with a client. Just like in a project, there is an initial engagement state. And I go back to my first question. Is there a difference between a customer that engaged you openly versus a customer that didn't, right? The engagement phase is certainly going to be longer if the customer did not reach out to you to begin with and it was told to work with you. Then there's the focusing phase. Then we go into evoking and planning. And there are different questions that we want to answer for the customer on each phase. So the idea is that everybody progresses through the phases, right? And planning leads to action and behavioral change. But we could also go back, right? Instead of like moving forward, we could go from focusing back to engaging. And I'm sure you have experienced this in the interactions with your customers at work, right? Sometimes it feels like we're moving forward and then something happened and we go backwards. So the goal is to use this as an anchor for all the interactions that we have with our customers, and also to think about the things that we can do to promote their movement from one phase to another, and also the things that we shouldn't do, or the messaging that might hinder their ability to move from one phase to another. So I think that's key. The other piece is the interviewing skills that we're going to use in the MI methodology. So we use open-ended questions, affirmations, reflections, summaries. All of these are interviewing skills that are not unique to motivational interviewing. What is really unique is how they are framed. And I really like this table. This is from a Canadian neonatologist that applies motivational interviewing in his practice to promote vaccination. And what I think is valuable here is that it really explains what makes these interviewing skills unique in MI. It's the interviewing skill within the objective, or within the context of a particular objective that you want to achieve. So, for example, if we think about reflective listening, which is a very common and well-used coaching and facilitation interviewing skill, within the context of MI, right, it's about highlighting on the discrepancy, highlighting on, you're saying that you don't want to do this, right? Or you're saying that you vaccinations are something that you're concerned about. But what's really that is positive about that? Like, you're doing it because you want to, or you're concerned about the safety of your kids. So it's highlighting the positive, right? And another piece, for example, in affirmations, right? You're affirming, but you're affirming with a goal, and the goal is to help that person feel empowered. So the affirmations have that purpose, right? Like, you want to make sure that they feel that they can do something, right? So there is a purpose. So it's basically the skills, but you use the interviewing skills with a particular purpose, with a particular goal within the MI framework. And the idea is that as we use the skills, we want to tilt that balance from that, no, I don't want to do this, right, to the positive side, to more change talk, until people would develop intrinsic motivation and they'll say, yes, I do want to do this because whatever reason. So they'll identify that. So the skills will enable, the interviewing skills will enable that. And we're just promoting that through the interactions that we have with the customers. I don't know. So now we're ready for a couple of questions. I don't know if anybody has any questions so far. So ready to take any Any questions, Mark?
We don't have any questions submitted so far, but one question that we maybe just to ask, maybe there's a quick answer. How did you first learn about motivational interviewing, Paola?
So I think I told this story before, but I actually through Mark Raven. So Mark came to NYU a while ago, and I was trying to find the best way to be a more effective change agent in the organization. He brought up MI. But at that point, I remember when we had the conversation, I didn't think it was, or there was anything unique about it. It sounded to me like another facilitation or another coaching kind of methodology that I really already had enough training in change management, in facilitation skills, in coaching. It just didn't feel to me like there was something new. I was resistant to change. I was not aware. Mm-hmm. But then I got to a point in which most of the work that we did in that organization was with customers that really wanted to work with us. So I really, we have learned that it was important to have that true engagement from the beginning. I was in a situation in which I had to work with a group of leaders that really did not openly requested the support of a lean consultant. And that was kind of my aha moment to realize that maybe there is something else, and maybe there is another set of skills, or maybe I could enhance my current facilitation skills. And this is when I decided to look into motivational interviewing. I found a course, then I took the course. It was a 2-day course, and I've been taking, you can go into the motivational interviewing network of practitioners, and I've been taking several online courses, and I also meet with a coach every 2 weeks. To practice the skills, and then to really, because it's really a different way of communicating, and to refine my MI skills with her. So it's been almost like, I think, over 2 years that I have been practicing. So.
Yeah. So there's one other question here, and if you want to hold it till the end, let me know. But I think it's an important question. How would motivational interviewing help with a patient who adamantly does not want to wear a mask or get a vaccine?
Yeah, so that's a really good question. So one of the things that motivational interviewing highlights is that we don't want to be antagonistic. So we want to approach anything with empathy and with the framework or the mindset of understanding. So if somebody doesn't want to wear a mask, the only thing that we can do is to understand why, right? What are the concerns? Like, what makes you think, or what are the, I don't want to say reasons, right? But what are some of the issues, or what's leading you to not wanting to wear a mask? So we just want to approach it with a learning mindset. We don't really know why, right? So from our perspective, wearing a mask is a must. And we understand, or from my perspective, we've gone through a process of understanding its value. We want to understand what is the thinking behind the fact that person does not wear a mask. And it's the same thing with vaccinations, right? What this Canadian doctor was saying is that you want to start ahead of the game. Like, you don't want to ask somebody to vaccinate their kids right now and start kind of promoting that. You want to start understanding what are the reasons. Then you could provide information about it and slowly build to that. So a lot of it is, for us, we were asked to wear a mask, right, overnight. So it's like the change, everybody was at different stages. So the change process is not the same. But my answer to that is, we want to always start with understanding what is the reasons, or what is the thinking behind not doing something, and take it with empathy, not judgmental. Mm-hmm. So it's not good or bad, one side or the other, at least from the MI perspective.
Yeah, I'll just add a thought. Like, if your goal is to help somebody change, you have to start from that place of respect and empathy. And one word that comes to mind, you mentioned earlier, the word ambivalence, that gets used in motivational interviewing. where people will often articulate they have reasons to get motivated, and to them, they have reasons not to. And so there are so we want to help people kind of, talk through the motivation instead of just telling them, well, you need to go get vaccinated because then they'll get defensive. And
Exactly.
and then we're not helping them.
Exactly. And I will talk about that in a second, right? So any kind of label that we use, not doing this is bad, or when you're judgmental, it actually hinders the process, right? So that is that whole thing that when I practice MI, it's a different mindset, because you clearly see things in a certain way. Like if we think about process improvement practitioners, it's sometimes really painful because you kind of see the light clearly at the end of the tunnel. But it's really about that that slide that I showed in the middle about where people are in the change process and where you are and what your expectations are. They are in a different place, and what you need to do is carry them through so that they do what we expect them to do. Hope that. Yeah. Any other questions, or we're good?
No, I think go ahead and move into the case studies. Sure.
Yeah. So now I'm going to, I think I want to try to make it as practical as possible. So we're going to go into some of the case studies. These are process improvement initiatives that I facilitated in different organizations. And I hope that you guys kind of see the practical side of this through the cases. So the first case study that I'm going to highlight is a case study that highlights the engagement process, which is the first step in the MI process, right? So I want to ask you a few questions, or I want to ask you a question. So take a moment and think about the following. Where were you the first time that you met your in-laws? And I just I want you guys to imagine yourselves like the first time you met your in-laws. Where were you? Were you at their house? Were you at a restaurant? Just quickly type in the chat. Let's see what answers. At their home. Yeah, so most people are saying that at their home. So then the next question is, did you ask all the questions that you had in mind? Right? Did you openly ask everything that you wanted to know, and maybe type in the chat yes, no? Most people said no. Yeah. So that, I think that is really the key through that engagement phase. It's almost like you're walking this fine line between learning as much as possible, right? To build a relationship, but also not asking too much so that you might hinder that relationship, or you might hinder the process of building that relationship. And my example, my case study for the engagement phase is from an experience that I had in the Department of Supply Chain. We were a couple of process improvement practitioners where we were told to go and find the defects and find reasons why the nurses didn't have what they needed to do their job. And so this was basically a push, somebody saying, go work with this department. And as we started building the relationship with the leaders in that department, I think most of us missed the point. Like, they were not even in contemplation. They were in pre-contemplation. There was no awareness about the need to work with our department to do anything. Like, there was no, they really had no awareness of some of the issues that they had. So we did a lot of this relationship building and trust building, which is what is essential in the first phase. But we also did a lot of things that kind of hinder the progress from engagement to the next phase. And so what you want to do is in how can you use motivational interviewing in an effective manner to really build engagement. I'm going to give you a couple of examples. As we would have meetings, we will hear statements like, we already worked with that consultant last year and nothing changed. Or we'll hear things like, oh, a Kaizen takes 4 days and at the end there are no results. So if you become antagonistic and you say, well, yes, maybe we didn't have results here, but like in the clinical departments, we had all kinds of really good results and positive results. That's not going to be helpful. If you start also selling all the results and outcomes of previous events, that's also not going to be helpful. What you want to do is really, again, create that connection and use, for example, a reflection. I understand that it must be tremendously difficult to work with a department or to work with a consultant and not get the results that you want. But I know that what you really care at the end of the day is that the clinical care team gets what they need. So you are identifying that positive piece, right? You're identifying that connection. So you're not focusing on the fact that the consultants are bad. Forget about that. The overall goal here is to highlight that they do want to do their best and they want to ensure that the clinical care team has what they need. And that is kind of the kind of communication style that you want to have. And that is going to really enable positive relationship building when you have somebody who's not in pre-engagement, who's not in an engagement phase. The other piece is that affirmations are really important here too. A lot of times when people are not engaged, they're not engaged because there are reasons behind that. So it could be that they want to retain control, and MI actually goes in through an entire list of reasons. It could be that it's all about, this is the only thing that I can control, wearing or not wearing a mask. It could be that you have tried multiple things and none of them have worked, and so now you've really lost your sense of self-efficacy. So affirmations are helpful because they'll restore autonomy and it'll empower the client. So you want to do things and say things like, you manage a really complex operation, right? We can't really run a hospital without you. I think there's one thing that is tremendously helpful and easy to implement is affirmations as you build relationships with your customers. And it has very positive results. A lot of people, especially in the healthcare industry, they go every day with the intention of doing their best, and they get a lot of barriers, right? So, if somebody comes in to tell them that they need to do something else in a different way, it's like, this is the last thing you want to hear. So affirmations kind of help people feel empowered and also restore the autonomy. So we did a little bit of that, but I think we could have done more of the affirmations. And some things to avoid, and I think I just mentioned this during the first half. The premature focus trap, like labeling things, right? And the premature focus trap and the label trap are one is a kind of like a more focused component of the larger one. So the premature focus trap is when you start saying, well, this is about scheduling, or this is about alcoholism. So it's like you're making already an assessment too quickly, right? And then you start labeling, right? Like, so it's really about the fact that they don't really want to do more, right? So those two things are connected, a negative label and then establishing or diagnosing the problem too soon. Even if it's clear to you that it's about X, Y, and Z, you don't want to do that at the beginning. You want to prevent that. And you also don't want to use any language that it's antagonistic or negative. And then also behaving like an expert, right? Having a list of things that you are kind of checking for. And do you have this? Do you have this other thing? Do you have the data that I need for this? Do you have the scorecard? Do you have, how do you quantify this? Not in the early stages. That would really hinder your ability to move to the next phases. And especially if they're not even engaged, if they're not openly asking for the support, that would definitely set you back. So just a few things to consider. The next phase within the MI process, if your engagement phase goes well and you're able to build that trust and that relationship is there, it's the focusing phase. And And sometimes you actually almost start in the focusing phase with some of the interactions that you have. Like people are already, the engagement phase is already took place, right? So that's also important to understand where the customer is. The customer might be pretty much ready to just focus, and you don't need to do as much of the relationship building in that case, because they're ready to just narrow the scope of the project. So now let's take a moment and think about this question. You just get assigned a new project, and things are really busy at work. In your spouse or partner wants you to take time off, and your spouse is asking you all of a sudden if you can take time off, right? So what would you say to that? What would be your answer? Yes, I can do it. Not now. Like, what would you say? I'm curious to see what people have to say. Let's see. No, my job is a priority. Yeah. So within the focus phase, I think something that is really important is to ensure that you are ready to really make a determination, to really focus, or to really narrow the scope of the issue that you're trying to address. If you try to do that too early, you might get a response like, no, not now, or no, we can discuss this problem right now. And that often happens when you're working with a project team or a process improvement team, and you try to bring something up that they're not ready to discuss yet. They're still just in the engagement phase, and they're really not even close to identify what the intervention or what the problem needs to be. So I think that's very important. So here's an example of a case study that I did for the accounts payable department at Kaizen, that I did for the accounts payable department. Here they were really ready to move forward. So they were basically in the focus phase. The director reached out to the department, to the lean team department, and indicated that lots of their processes were manual. They were ready to automate everything, and they wanted some support. So there's very little need here for engagement, right? You can definitely do some of that. But they're ready for you to go in and just start discussing the objectives of the project, and then just identifying basically what elements do you need to focus on. Here, you still want to ensure that you're not that you still leave the autonomy on the customer, that you're not really pushing too much for what you think the objective or the metric or the target should be. I think that's something that we tend to do, especially during the focus phase. It's easy to get into, it should be this particular target, or it should be this particular objective or metric, since they seem so ready. So what are some of the indicators of somebody who's already in the focus phase? You'll hear them say things like, we want to ensure our members' account balance is accurate, and also that we decrease the time that it takes. Like, they want all these things, and they'll provide a list of all the things that they want. And then sometimes you might hear them say things like, but I don't know where to start, right? There are a couple of things that you can do in MI here to then continue to progress to the next phase. One is open-ended questions, right? So let's talk about more in detail about some of the things that you want to do. And then you can also use reflections, right? But I think the most important here is what I'm going to highlight in the next slide, which is this tool called elicit, provide, elicit. So when somebody clearly indicates something like, I don't know where to start, or I don't know, what to do first. Here is where you can provide opinions and provide your expertise, but you can still do it in a way in which you still maintain the autonomy and ensuring that the customer still maintains autonomy. So for example, and I use this a lot at work, you could say something like, would it be okay to share with you how I addressed this issue before? And then you provide your advice. all your processes are connected. So we need to really kind of identify the triggers at the beginning and end point. And then once we do that, then we can prioritize them and identify what we need to start and focus on, or which process needs to be tackled first. And then you can say, what are your thoughts about this approach? And so you go back and give them the opportunity to really respond, so that they have autonomy, and it's still on them to say, yes, I want to do this. No, I don't want to do this. So I think this is a good way. It's only useful if they're ready and they're in that phase. If you start providing opinions or asking for permission, right? Would it be okay to share too early? That could also hinder your progress. So that's very useful. I definitely value that method or that technique at work a lot. Again, things to not do, the writing reflex. And when you're in the focus phase, it's really easy to tell people what to do. It just feels like they're ready. And so you certainly don't want to do that. Every time I do it, it backfires. Like they actually respond with no, I don't think that's what I was thinking. I'm like, oh, I think I probably provided too much direct advice. So they also don't want to feel like they're just another thing that you're completed, or that you are completed in your checklist, right? That you're just really focused on the steps that you need to follow, but not on what they need, right? So nobody likes to feel like you're just another task. People want to feel like you care about them. And so that's really important. And especially when you get to this piece, when you're refining the scope of a project, like you get to like, okay, we need to do this and then this other thing. So it tends to feel like you're just moving forward with the phases that you have in your framework to do process improvement work. But it's really not about, are you really helping them? Are you really helping me get to where I need to get? And also, you don't want to take control. So if you're working with a team, or if you're having a conversation with your staff and they're brainstorming about something, let them brainstorm. Let them go through that process of have that conversation, because that's part of the change process for them. And that has value. And sometimes you want to go in and kind of take control and say, okay, let's just narrow it down, right? But that actually would hinder also the ability to move to the next phase. The next phase within the MI process is the evoking phase. And you see, or you typically experience this phase in an interaction with a customer when you are either helping them develop a future state, or when you are helping them come up with interventions, or if this is part of a PDCA cycle that you're running, or a change initiative, they're basically in the evoking phase. So they're about to come up with some actions that are going to be the end result of your initiative. So now let's take a moment and let's think about the following. Do you believe you can influence your client's readiness for change? Is there what would be the answer to that? Yes or no? I'm curious to hear what people have to say. Let's see.
Sorry to hear there's a few no responses.
Okay. Yeah. I know this is a polarizing question. So it's good to see 50-50. Yeah, I almost see a 50-50, right? Yeah. So MI operates under the assumption that you can influence your customers' readiness for change. But in reality, we're not, we don't have unlimited time. So there are barriers, and there are other elements in an organization that really hinder our ability to do this, right? We're not therapists, but really the assumption is that if we have unlimited time and we gain all the MI skills and apply the framework, we could really enable and influence somebody's readiness to embrace change. So I think that's a very interesting assumption. This last case study, it's a case study from the emergency department. We were doing a Kaizen event, and on the third day of the Kaizen event, when we were about to come up with the new, the future state, and implement some of the changes that or design some of the changes that we wanted to implement moving forward, I would hear things like, well, we would like to do this, but this but statement, which is what is typical of the evoking phase. It's like you're already engaged, you already focused on the issue that you want to address. Now you're ready to come up with the interventions, right? So you're almost there. And this is where you're going to hear a lot of change talk. And this is going to present an opportunity to really use MI to reinforce that change talk, to hear people say more of that positive language that we want them to express before we get to the action phase. So what are some of the things that help here? We want to focus on the why. Why do we want to do this? And we also want to avoid arguing or telling. And sometimes if you're working with a team, if you have, you're managing a department and you're about to come up with actions and you want them to come up with something specific, then it might feel like you're arguing for something. And so that's something that you want to avoid. It's not about that. So the motivational interview and the way that we can communicate and the way that we promote change talk is really using this framework. Like, what are some of the things that we can do as we ask questions, as we communicate? What are we trying to do? So we want to try to stimulate desire. We want to try to ensure that people feel that they can do something. We want to reinforce the reasons, like why should you do this, and the need to do it. So they use this acronym of DARN CATS, and I'm going to talk about the DARN piece first. But it's basically the content of the communication, the messaging around the communication. It's around these 4 elements, right? So, for example, if we go back to the emergency department case study, if we think about desire, like what services do you envision providing 5 years from now? So we ended up doing vision statement and really helping them see what's the future for them? What do they want to achieve 5 years from now? Where do you want to go? So desire will promote action, right? So we want to identify that desire, help them identify that desire. Then ability is, for example, if you want to call a patient specialist, how much time would it take, right? Can you actually do it? So you want to help them envision that they can actually do that. So this is key because sometimes you can see that you can do something. And so kind of creating that, the conditions for people to envision in doing something enables change. You sometimes we're limited by what we think we can do. Then reasons. Reasons is another piece. Like, what are some of the advantages? Like, why do you want to do something? What are some of the reasons to call the providers, right? So what are the advantages that the clinical care team can have if you do these? And the need. How important is for you as a nurse to talk with the patient specialist? Like, is there a need to do this? So those 4 things, they know the answers, right? Like, the only thing that we can do is ask the questions. And as they go through the process of thinking about the answers, eventually that should lead to action. And that's actually what happened in that Kaizen session as well. Some things to avoid that could hinder progress, and I'm actually guilty of some of this. Taking sides, saying, for example, I really wanted them to implement that change, right? To do some of the the coordination of care activities, saying things like, well, if we do this, we can also bring in more revenue for the hospital because then the patients will remain in our network. And you're basically taking sides. You're basically saying we should do this because I think there's a reason, right? Like I have a particular motivation to promote that particular intervention or change initiative. That doesn't work, right? So you want to ensure that they're the ones who really need to identify the reason to do something. So it's not about what I think they should be doing. And then asking judgmental questions. When I was with that particular Kaizen event, I remember highlighting a story in which I mentioned how difficult it was to go to the hospital, and I was about to deliver my son, and some of the medical records that they needed to have were not there, right? So if you have coordination of care activities, then you could prevent that. But that sounded judgmental. So instead of like promoting a positive reaction, I immediately had a negative reaction, even though that was not the intention. So anything that sounds judgmental, it's going to hinder progress. Yes.
Paola, I apologize. We're almost out of time. So maybe if you can just touch on planning very quickly. I don't think we.
Yeah. So the planning phase, I think planning phase is there's really not a lot to it, right? Because once you progress all the way from all the different stages, planning phase is downhill, right? So it's literally promoting commitment, activation, and taking steps. If you think about building an action plan for a project, that's what you're already doing, and you're already using motivational interviewing there. So it's like, how do we do this? What are the next steps? We're ready to run the pilot. So how do we run the pilot? Who's going to do what, right? So it's just kind of going through the steps that we typically go when we're ready to just move forward with the change. So I think that's something that we could definitely do. I think that's it. So if anybody has any questions, the final takeaway here is we want to help people resolve that ambivalence to change. And we want to use motivational interviewing as a tool to do that. And when we do that effectively, we're able to implement change initiatives without very little pushback. So that's really the key to project success and to effective change management in an organization. That's it.
Okay. So we might be able to, there were a handful of questions. Maybe there's an opportunity to follow up with people via email or come up with another way of sharing some of those questions. So thank you, Paola. This is such a rich topic, so it's difficult to cover in a short time here. But I just want to make a couple announcements. If you can advance it, please. Upcoming webinars, if you are a KaiNexus customer, the next training team office hours is going to be held on August 12th. You can register for that at kainexus.com/webinars. The next presentation webinar is going to be on August 10th, 1 o'clock Eastern. Adam Lawrence talking about concepts from his book called The Wheel of Sustainability. That webinar is open to everybody, and the registration for that should be open later today or at the latest tomorrow. I want to tell you about a few other resources. We have our webinar library. If you can advance that real quick. All our past webinars are in the library at kainexus.com/webinars. The recording of this one will also reside there and on our YouTube channel. We have a blog at blog.kainexus.com. And then the final thing is our podcast. If you can advance it, please. The audio of today's session will be available in the podcast feed, kainexus.com/podcast. So maybe if you just want to put on the last Q&A slide with that shows your contact info, Paola. A lot of comments here. Great presentation. Thank you. Thank you for sharing this information. I learned a lot. This is a fascinating topic. Really like your approach to change. Scott also says, thank you very much. Fantastic session from Lily. Paola, is there anything else that you'd like to add as a final thought to end on here today?
I think we have an opportunity right now to redesign how we work and how we think about work in general. But to be able to do that, we really need to be able to be good change agents, and to really help people change. I think motivational interviewing provides a good framework to do that, and to have conversations with people about change in an effective way. So I would say that's my final comment, is to think about it as, if we want to rebuild the future, right, after everything that we've gone through with this virus, we need to be able to really understand how can we help people go through the change process. And this is a methodology that would help us do that. So just take the elements of it that you think are valuable, and use them to be an effective change agent in your organization.
All right. Well, again, thank you very much, Paola. Our presenter today has been Paola Torres. Really want to thank you for helping introduce people to this important topic, or help. I think every time, I've heard many presentations about this. I've tried to practice it and teach it, and every time I hear somebody else, including yourself here today, presenting it, it gives me more food for thought as we're trying to help people through change. So again, thank you, Paola. Thank you, everybody, for attending today, and we'll hope to see you at the next webinar. Thanks again.
Thank you.